Woman's health is often a neglected topic. Although the role of a woman in the household and society is pivotal, importance to her health is mostly low on priority. A woman is very consumed with work and looking after her family. The to-do list for her is so long that her well-being gets compromised. Many serious diseases progress silently until they have reached an advanced stage when treatment becomes more complicated. Unlike some diseases where the symptoms are obvious, silent killers develop gradually, are almost unnoticeable, causing irreversible damage before they are detected. Awareness of these conditions is the first step to safeguard our life. Early diagnosis, prevention, and simple changes like lifestyle modification can save lives. 1. Heart disease is a leading cause of death in SA women. It is more common than our perception. Heart attack occurs only to men is a misconception. It often remains undiagnosed in women, as the symptoms may be subtle and different from the way it presents in men. Men typically experience chest pain and sweating, but in women the symptoms may be atypical, like fatigue, breathlessness, nausea, pain in the jaw or upper back. Very often these are attributed to acidity, stress delaying the diagnosis. The risk of heart diseases increases when blood pressure, diabetes, and cholesterol are uncontrolled. Regular health checkup, including blood pressure, cholesterol, blood sugar monitoring, is very crucial. A healthy diet rich in vegetables, fruits, grains, regular exercise, stress management can significantly lower the risk. Of course, it's equally necessary to limit alcohol and give up smoking. 2. Breast cancer is the most common cancer occurring in SA women. WHO has estimated that 1 in 29 women is at a risk of developing this disease. Since the initial symptoms are not obvious, more than 60% of women reach the doctor when in an advanced stage. Unexplained changes in the breast shape, size, texture, changes in the skin or nipple, any lumps in the breast or underarm, painless or painful, could be the warning signs which should not be ignored. Early detection is a game changer in breast cancer. When detected early with prompt and appropriate treatment, we can aim at almost complete cure. Awareness is the key. It is advised for women 20 years onwards practice monthly breast self-examination. From 40 years onwards, yearly mammogram can improve early detection rates. When in doubt, do not hesitate to see your doctor. Regular exercise, maintaining healthy weight, breastfeeding for 1 year, avoiding long-term oral contraceptive pills, hormone replacement therapy can reduce breast cancer risk. 3. Ovarian cancer is very deceptive. It's a silent killer because the symptoms are very vague and can be mistaken for urinary or digestive issues. Persistent abdominal bloating, pelvic pain, frequent urination, loss of appetite should make one alert to seek medical help. Unfortunately, there are no reliable screening tools for ovarian cancer. Regular transvaginal scans, blood tests like CA 125 are recommended for high-risk patients. Genetic testing like BRCA1 and 2 can help in assessing the risk of future cancer. 4. Osteoporosis is commonly seen in women, especially after menopause. It weakens the bones, making them prone to fractures. Bone loss is never sudden. It happens gradually, hence women fail to notice, and an inconspicuous fall can lead to a major fracture of bones like hip, spine, and wrist. To prevent osteoporosis, it's vital to exercise regularly, especially weight-bearing exercises. Ensure vitamin D and calcium levels are normal. If need be, with your doctor's prescription, it can be corrected with supplements. Bone densitometry yearly after menopause can detect osteoporosis early. 5. Diabetes mellitus is an epidemic and women are not spared. Very often women fail to realize they have diabetes until complications arise. Beware of the warning signs: excessive thirst, frequent urination, unexplained weight loss or gain, fatigue, non-healing wounds, blurring of vision. Uncontrolled diabetes can lead to many complications like kidney failure, heart attacks, vision loss, nerve damage, blocking of the blood vessels, etc. Regular blood sugar monitoring are essential for early detection. Low sugar, high fiber diet, regular exercise helps maintain the sugar levels. Gestational diabetes occurs in some pregnant women. Frequent sugar testing during pregnancy is highly recommended. Women's health needs to be prioritized, especially by woman herself. Be aware of the signs and symptoms of these silent killers. Early detection leads to better outcomes. Adopting a healthy lifestyle, regular exercise, healthy food choices, periodical health checkup, and paying attention to the body's signals are key to beat these silent killer diseases. This Women's Day, let's accelerate action and resolute to prioritize our health.